Welcome back to another episode of the Braun Performance Rehab Podcast. Joining me today is Allie O'Leary, Kara O'Rourke, Austin Colish, and Zack Schreier. The five of us are going to be discussing considerations for athletes with type 1 diabetes. So whether you are an athlete who has type 1 diabetes, or you're a coach, clinician, practitioner, whatever title you might have, there's so many amazing insights and nuggets of knowledge packed into this episode. Austin, Allie, Kara, and Zack all have type 1 diabetes, yet they have not let that stop or hinder them in any way. They've been able to go out and engage in high-level sport, and now they're on the other side and trying to turn around and have a positive impact on the next generation of athletes, whether that be as a coach, as a trainer, as an entrepreneur, or as a physical therapist. I have so much respect for these four amazing individuals, and I'm really appreciative of their time and everything they're able to share with us on the podcast today. Episodes like this are made possible by ISOFIT. ISOFIT is the official sponsor for season 5 of the podcast and helps athletes to win more and hurt less. ISOFIT is my go-to choice for all things relating to isometric strength training. For more on ISOFIT, you can check the description below. Enjoy. Allie, Kara, Austin, Zack, welcome to the podcast. I'm super excited to work with the four of you today. Thank you so much for being here. I really appreciate your time.
Thank you, Dan.
Thanks for having us, Dan.
For people who might not be familiar with the four of you that way, and maybe they aren't sure why I picked the four of you for this or what your backstories are with a diagnosis that I think people hear a lot about, but don't necessarily understand the implications of type 1 diabetes that way. Would you mind filling everyone in a little bit about who you are, your backstory, your diagnosis story, and all the amazing things that you've been able to do despite being diagnosed with something that a lot of people probably feel is a little bit scary and intimidating at first?
Hi guys, I'm Kara O'Rourke. I have been a type 1 diabetic for 16 years now. I was originally diagnosed when it was called juvenile diabetes, so at the young age of 6, I was diagnosed, and luckily I grew up in a medical family, so that gave me a really good idea of how diabetes works. And from there, I've been able to do a lot of challenging things, whether that was pre-professional dance and transitioning now into bodybuilding, personal training, and continued education within those. I've been able to teach people through my own experience as a diabetic, and now I'm a personal trainer who specializes in it. So it's definitely something I've gotten a lot of experience with, and I enjoy a lot.
Hi, I'm Allie. I was diagnosed with type 1 diabetes in 2012. It was my freshman year of high school. It was the first day of lacrosse tryouts. It went a little different than I expected it to. I never had any family history of it or anything like that, but my joking story is I did have a best friend in high school who was short, blonde, and also named Allie, who had type 1 diabetes. And when I got called into the doctor's office after they got my lab panel back, I jokingly, my mom, we were super organic and ate really healthy. And she had packed me like miniature Reese's that day. So when she was driving me to the doctor's office, I popped a few in my mouth and said, oh my gosh, what if they told me something crazy like I have diabetes like Allie does? So about 10 minutes later, that's what they told me. But again, no family history, so it was like brand new territory for myself, my family. It was a little scary at first. I played travel soccer, travel lacrosse, was super active. So there was a bit of a moment of figuring out kind of what that looked like. But I knew all that stuff was very important to me. So that's kind of what kept me motivated into figuring this out. It definitely wasn't going to be something that ever held me back. And I ended up playing a year of college soccer and about 3.5 years of college lacrosse. I got cut off with the COVID year. And from there, I was driven to get my MPH to kind of help with that thing around the community. And now I coach. I coach lacrosse and soccer at local high schools, and I coach travel lacrosse now as well. And I've been fortunate enough to coach a few diabetic athletes and kind of help them in a way that I wish someone had been there for me when I was getting diagnosed. So, yeah.
I was diagnosed when I was 11 in 6th grade, and that was a crazy month. I'm sure you guys all had similar stuff like in the lead up. But like I think I was maybe 100 pounds in 5'2" or something like that, and by the end of the month I was 65 pounds, and like extreme acceleration at the end there, and So that, we knew something was wrong, but we didn't have anybody with diabetes in the family or anything or around us. And so, it was a surprise when I heard that was the case at the hospital. There for like 3 days, and basically just getting everything kind of regularized and learning and all that. And they had mentioned this thing about like, you have to keep a journal with your blood sugars and your foods and insulin and all that. And on the way home, I was like, Mom, Dad, like, I don't have to do that, right? And they were like, you absolutely have to do it. This is super serious. Like, you have to do it. And so I took it pretty seriously. And I started running experiments, and I was like, check my sugar like every 10 minutes for days, just trying to learn how everything worked, basically. And so I feel like I got a pretty good hang of it, like off of that. And then, I think things shifted with running. I was a runner in high school, and then for a couple of years during college. I would have gotten cut off by COVID, but actually I took a gap year to work on something, got out of shape, and decided not to embarrass myself with more running when I came back. So I spent 2 years running in college. But let's see. I think I'm sure we'll talk about similar stuff, but I feel like it has impacted my sort of personality and interest to some extent. And one of the interesting things is like we get more of an insight into what the body's up to than anybody. And so there's kind of like I don't know, like sometimes the culture picks up on a concept, and we kind of already know something about that. And even some of the ways in which the public discussion about that is wrong. So that's been interesting. Now I'm just trying to stay healthy, stay stable, not stress about it too much. Glad with all the minor tech. That's about it for now.
All right, I'll go next. So, hi everyone, my name is Austin Colish. I'm a doctor of physical therapy based out of Baltimore, Maryland. And diabetes has, in a way, given me a lot of like that initial push to kind of set me on the path and trend I am today. So for anyone who knows me personally, I didn't grow up playing sports. I didn't really grow up in a sports household. I was diagnosed 2004. So this is actually my 20th year diaversary. But I was diagnosed at age 10, and then that kind of like set me on my journey. So once I was initially diagnosed with type 1 diabetes, the year following, I was diagnosed with celiac disease. So clearly there was some autoimmune crossover there. But as I mentioned, like I didn't really play sports growing up. So kind of as I was like figuring out this diabetes journey, as I'm sure we all have, I found the sport of lacrosse, and that was just on a whim that my mom had signed me up for a summer camp. And she kind of forced me to do it just because she felt like I needed something kind of to distract me in my life as I was going through all this in middle school. And I am so grateful for that moment. And really the sport of lacrosse and like sports has shown me a way to kind of like master that, and learning how to use like diabetes as a medium totally set me on my path forward. So, and I'm sure we could talk about a little bit of this as well. That also set me on my path to PT. And really what the biggest things I learned from that is just patient advocacy. And as Zach mentioned, just like body awareness and learning how to kind of utilize exercise as a medicine. That's something that I preach every day with my patients when I work with them. Yeah, I mean, being someone who's type 1 diabetic, I've been able to accomplish a lot of things in my life, including playing 4 years of NCAA lacrosse. So, I played at a D3 school, and then I had the opportunity to play into graduate school as well. And I still play. So I still play at a semi-pro level, and then I also play in an international level as well for our Team Portugal team. I'm sure this will be a common theme, but just because you have diabetes doesn't mean you can't do awesome stuff. So that's my short pitch.
Yeah, no, I think you all have such incredible backstories that way, and it's so interesting for me on the outside perspective, thinking about where I was when I was 6 years old, when I was a freshman in high school, or where I was 20 years ago, and just thinking about this concept of being in that kind of spot and then being told some news about a diagnosis that I know nothing about and know it's going to be life altering, but a lot of people really don't fully grasp the concept of. And I think that, a lot of times if you're in that situation, you look for healthcare providers, you look for coaches, you look for people to know how to help you. And the unfortunate truth and unfortunate reality is I feel like we are under-equipped and under-prepared to provide for athletes who have type 1 diabetes. I certainly don't know everything, and I make no claims to be an expert in this space. But I think that the more we have conversations with people such as all of you who have done it successfully and done it successfully for a number of years, the better this space is going to be for the athletes, the next generation of athletes, I'll say. So I want to hear more from each of you a little bit. Tell me about devices that you use, different sugar levels, how you've gone about managing type 1 diabetes as you've pursued a variety of different sports endeavors, whether it's lacrosse or soccer or running or bodybuilding or dance or whatever it is. How were you able to make it work? Because I feel like a lot of times clinicians in particular are probably going to look at you and say, well, don't do that. It's risky, or this could happen, or that could happen. And I really think we need to shift our mindset from disablement to enablement. So how were you all able to do that in your own lives and your own walks that way?
As you were just saying, like clinicians, you kind of look for their support. I'll never forget the first doctor I ever had told me I would never get to play sports the same way that I had been playing them, and that I would never get to kind of get to that next level. It was just going to be way too hard to be able to regulate myself, and there just wasn't a way I would be able to do it at a very, very competitive level. So naturally, anybody that knows me knows I immediately asked for a new doctor. Never saw him again, kicked him out of the room because like you were saying, Austin, it's kind of just a fun extra thing to worry about. Diabetes is definitely not something that ever has to stop you. I know it looks different for me every day, depending on what I'm doing, what I need to eat beforehand, what I might like. I trained for a half marathon for a while, and I definitely always had a little fanny pack on me with an apple juice and some gummies just in case. If I'm going on a walk, I don't really worry about it too much. Weightlifting can look different for me. Sports, I was a diehard PBJ girl. I always had half a sandwich before I went out for a game, but I feel like the biggest thing for me, at least as an athlete in college, I had to respect that every day looked different for me, and the hormones of it all, being overly stressed, overly tired, exhausted. What worked for me one day might not work for me the next. So I kind of just learned I had to be prepared for everything, prepare not to fail, but to maybe have an emergency. Like I said, I always have stuff on me, gummies, juice, everything like that, because there have been times I've needed it. There's been times that I've given it to other people who I didn't even realize had diabetes that were with me in these situations that needed it too. But I feel like the biggest thing for sports that I learned is like every day looks different, and it's okay to have a bad day. It's okay for every day to look different, but you just have to really, really hone into your body and listen to your body, and just respect that if today is not the day that you're able to do every single thing that you want to do, like that's okay. It doesn't make you any less of an athlete. And that was pretty hard for me to overcome for a while.
Completely agreed with that. I think when you're faced with diabetes, coming at it with a point of strength, it's not inhibition. Like you can do anything you want with it. I love the term diabadass. I like hardcore think a lot of people have been told they can't do something or won't do something. And most diabetics come at it with spite. I think most of us here have all faced that kind of challenge and come at it with that strong point. I definitely think my sport experience has been different from what somebody who doesn't have diabetes has experienced, but I'll never know because I've always had diabetes. That being said, like glucose tabs always have been like my life savior. When I wanted to get into bodybuilding, it was definitely not supported by my initial endocrinologist. But I grew up pretty close to Geisinger, which is a hub for juvenile diabetes. And I did eventually find a clinician who was like, well, you're already tracking all of your food. Why wouldn't you do it? If you're already measuring everything you have, you just have to measure a little less. I think a lot of things in my experience have been a learning path. Nothing has been conventionally easy. You do have to be able to face a challenge and be willing to, especially when you're like, okay, so I can't do it that way. How am I going to make it to adjust? You have to think fast on your feet, and you do constantly have to think about it, which is something I don't think a lot of clinicians think about. It is something that is constantly in the background. I know for me, I'm like, am I low? Am I tired? Am I anxious? It's kind of like I'm 45. That's why. Things like adrenaline for me really impact my sugar. So anytime I was doing anything like a little bit scary, my sugar would immediately jump up, and I knew that aerobic exercise, so like anything with high intensity, like a CrossFit workout, would cause my sugar to shoot up, and I'd have to make sure I don't over dose so I don't pass out. Because the worst thing is to be like, I just had a really hard workout, my sugar is 260, and then I have an automatic pump, it doses too much, and now I'm 45. Feels like counteracting your whole entire like activity or the point of activity. So even just having somebody who knows that, especially if I'm thinking of clinicians, having glucose tabs or some kind of little snack is awesome for anybody you have who's a diabetic, like literally life-saving. They're like $2 at CVS. You can get a glucose gel, and that's really useful if anybody were to pass out. It could be like legitimately life-saving. So that's my experience with how I've like managed it in those stressful sports. But
I'll jump in next. Kara and Allie, I'm so jealous that you guys like, it sounds like, well, one, Kara, it sounds like you came from like an educated healthcare background. Like I didn't have that. So all the education I got was directly from the clinicians that had worked with me. And Allie, just listening to your backstory, it sounds like you were already in sports and like you kind of had that as a medium. Like I was learning how to like run at the same time. I was like learning how to manage my blood glucose. So I kind of alluded to it like with a little bit of my backstory, but once I had like fully embraced like the sport world and fell in love with lacrosse and got into weightlifting and training through high school and had made that mental commitment to like I want to play in college, this whole time I didn't like everything you just mentioned there, by the way, is gold, Kara, regarding like different energy systems and how that affects blood sugar. That took me like 6 to 8 years to figure out on my own because none of the endocrinologists I had worked with had ever explained any of that to me. And so it was really frustrating. It was really hard just from one, like getting into the sport really late, and worrying about like the skill acquisition aspect of the sport and then getting recruited and then having an opportunity to play in college. But then once I was on the field, not knowing what the hell do I need to eat before practice, or how often should I be testing my blood sugar during a game, or why is it during a game at halftime my blood sugar is 300, but during a practice halfway through it's not. And so I think a lot of what you guys talked on in terms of like how the hormones affect, and I'm sure we can get a little bit more into this, but I think resoundingly like every diabetic's going to have their own journey with that. I know for me, it wasn't until my junior year where I had done some endocrinologist shopping. I had gotten really frustrated with the endo I had seen. And just to like paint a picture for you guys, it was I would go in every 3 to 6 months. They would look at my A1C. I would sit in the waiting room for 20 to 25 minutes. I would then be taken back to the room. I would sit there for 10 to 15 minutes. The endo would come in, look at the sheet, say, oh yeah, you got to get your A1C down, and then close the book and then leave. I'm like, dude, what? Like, I'm struggling with like management. I don't know what to do when I'm sick. I don't know. How come when I go on a hike, my blood sugar drops? How come when I eat certain things, my blood sugar goes up? Like, and so it wasn't until I had the opportunity to meet with one of the PAs in the practice, and she sat down with me, handed me some like research articles, and was like, hey, I heard a little bit about what you're struggling with. I want to help you out from a college athlete perspective and what we can do to help you with that. And that was the first time ever in at least the American healthcare system I had seen someone like address me as a person and say, this is the problem that I'm hearing. I'm going to help you. And we're going to work on this together. And then over the series of like 2-3 months of just like trying different things out, trying different foods out, trying different boluses. Like I didn't even know, hey, I'm going to go exercise for 2 hours. I shouldn't give a full bolus before I went in. So then I was having these like terrible lows. And it sounds like, you know, obviously you guys have all had the education on that. That's something I had to figure out through trial and error. And I give a lot of credit to that PA. And really her like showcasing of empathy is like what set me on my path to find a field in healthcare where, and I take a lot of pride in this. Like when I'm treating a patient, I'm not just seeing an ACL or their knee. I'm treating, you know, a person and knowing their backstory, knowing what drives them, knowing what motivates them, knowing what stresses them out, because I think that's the number one thing you could do. And Allie mentioned you're a coach as well for like a high school. I coach high school as well. I tremendously would recommend that if you are in a position as a PT, as a coach, as any type of healthcare professional, and you have someone who's type 1 diabetic, take some time to ask them some of these questions of like, how's your management? And again, like some of those other soft skills in terms of like empathizing with them and finding out what their goals are, it goes a long way and it means a lot, especially for someone who is type 1.
Everyone raised awesome stuff. I wish I had taken notes or something so I could remember some of the things I was going to respond with. But on the last point about sort of endocrinologists, like I've seen a handful that are like generally well-meaning. Everybody's been pretty well-meaning, but also like super overbooked and like has a template for how to handle this stuff and doesn't want to customize it or doesn't have the bandwidth to customize for each patient. So it does feel like we've all kind of learned that this is something that we have to just learn ourselves. Like, and that's probably all well and good because our bodies are different and things are changing all the time. Like, I think one of the what I was only, like I said, 11 when I was diagnosed, and I was like supposed to call the doctors anytime I was thinking about changing my dose. Like, they said, like, here's your, like, your 1 to 10 Novolog dose and your here's your Lantus dose, etc. per day. And I think one of the most useful things that I learned early was, like, we have to be able to make those changes on the fly, like whether that's time of day or stress or sleep or differing levels of activity across weeks or months. And so, like, I feel like basically altering my Lantus is kind of like my 24-hour octane insulin is like the most, or one of the key levers when it comes to like my activity and intake. So that's a decision I make basically every day. I don't have a set Lantus. Of course, it's within range. Also, one thing you mentioned that has definitely been applicable for me is like different levels of activity or different intensities of activity, even the same intensity but at different times of day, have such drastically different effects. And nobody ever explained that. I don't think the doctors themselves, since they didn't have a direct interface with how variable this stuff was, they didn't appreciate this. One thing that like non-diabetics are often trying to do is to get like a highly compressed version of how it all works. And I find that to be a totally misguided activity too. Like, they're like, so when do you do this? When do you do this? I'm just like, it's like, I mean, there's too much going on to say that. But yeah, a few of the things I've noticed, definitely higher intensity activity, especially when there's not that much insulin on board, will lead to rising sugars. Lower activity, like lower heart rate, lower intensity activity, especially like sustained, whether there's much or not very much insulin on board, will cause me to drop. And I also noticed, like, with a different level of historical training, like a different amount of like sort of development of my aerobic system, my response became different. So when I was starting to run, anything would drop me, and so my strategy was basically just Allie, is it? Yeah, Allie. I think you mentioned PB&J. Unfortunately, my go-to was a Snickers bar, but that's what I would do. I would eat a Snickers bar before every single cross-country practice in high school until like junior year, and then I realized it really depended on the level of intensity of the exercise. So I think this really struck me when we ran a 3-mile race, the first race of the season, my junior year, and that morning I was like, okay, I've got to do my usual thing and have all these carbs so I can be ready to race. I probably went into the race with a sugar of about 200 because I wanted, as a precautionary principle, like I didn't want to be going low during the race. And I felt awful on the finish, like just like dead. I couldn't sprint like you're supposed to at the finish. And my coach was like, hey, you're really supposed to like bring it in pretty hard at the finish and spend everything you had. I was like, that was like, I'm about to pass out. That was everything I had. Sugar was 450. So I realized, like, not enough insulin on board, too many carbs, and too high intensity early in the morning, recipe for disaster. So, I mean, and obviously it changes all the time. There's so many lessons, even high intensity when there's a lot of insulin on board or a lot of insulin prior in the day, even if it wouldn't like equate to insulin on board in terms of the pumps algorithm. I noticed that can be, that can spike less than without. So yeah, lots of different things. I think the lesson really is that we just have to figure it out and be ready to kind of change our algorithm as we go.
I will just say, like, already this makes me feel so much better just because something like with clinicians, like you were saying, Austin, like sometimes the empathy is not there. The sympathy of what we have to do every day is not there. I feel like when I was diagnosed, it like perfection was pushed. Everything was counted. If you were going low, it's 15 carbs only, and then you're waiting 15 minutes, and then you're trying again, which I don't know if that doctor had ever been 60 and dropping before. I'm definitely not waiting to keep going. Like I'm going to continue to kind of eat a little bit until I feel better. But like, again, perfection was just pushed, and I got into this, and it happens all the time still, of like, I feel like I'm not doing a good enough job as a diabetic. But then kind of like, Kara, what you were saying is it's something that's literally always there. I can't get away from it. Same way with sports, like I've had to respect that not every day is perfect. And no matter how hard you try, some days your body is just in control and it's not going to respond the right way to what you want to do. But it's always like really reassuring to hear people be very real, especially athletes, of just like, no, my sugar does not stay 180 the entire time. Like I was playing the game or running the race or doing the lift, like it popped over 300, or like I had a crazy drop 5 minutes after I finished and had to gorge myself with apple juice or gummies or something. So it's just really nice to kind of just that reminder again, like not everything is perfect, not every day is perfect, and like we're real people just really doing our best.
Has anyone else had a story like that, like Zach did? Like Zach, I think I can totally relate with that. Like big race, you're gearing up for it best you can, and then guess what? Like crap happens. You still got to compete. I definitely experienced something like that. I had the opportunity to play in the Lacrosse World Games in 2014 in Denver. It was the last day of the games. It was the last game that we were playing in, and we had an awesome opportunity. It was actually going to be on ESPN3. So it was the first time I had like ever played on camera before, and it was a really big deal to me. My pump broke like 3 hours before the game, and I was like, I need to play. And so somewhere out there on ESPN is the entire game of me playing a game at like 350. I ended up scoring that game, and I like lost my mind at the end. But I don't know how I did that, but that like is always like a moment that kind of carries with me. I'm curious if you two had experiences like that as well.
Definitely had a lot of I think what I think about the most, no clinician would know how to direct through this, but now I do. But post bodybuilding show, nobody told me the effects that my sugar would go through after not eating all day and then eating a large meal that night. I have never, like, as an adult, my sugar being higher 500s, I was like, oh, I've never felt this bad ever, actually. And like normal people, they'd be like, oh, I just ate a lot of carbs, that's fine. Oh my gosh, I was like comatose in bed and not going to get up for a while, kind of thing. And then the other opposite side is like extreme lows. I feel like nobody talks about how sluggish and like I suddenly turn drunk and in the middle of the day. It's like, oh, that's a very like noteworthy thing, even as a clinician, to know when somebody starts like dying down, getting quiet, kind of shaky, not making a lot of sense. It's not because anything, like it's their sugar's low. But like when you're playing, my thing is when I'm lifting, as soon as I get that feeling, I'm like, okay, I'm gonna put the weight down and I'm gonna sit down for a sec, because I don't want to get pinned under a bar or anything like that. But those kind of things, definitely. Allie, do you have any?
Yeah, I mean, I have like even I had to learn a special way to like wrap my Dexcom in college because I played lacrosse and soccer, mainly lacrosse, but there was certainly one time like I was playing down in Florida and some girl went to check me and hit my arm instead, and I just watched my Dexcom fly off of my body onto the ground. And it was like I was the ball holder in that situation. I was like, well, I can't really stop. So, I mean, I obviously have a beater and everything with me. I didn't have an extra Dexcom with me because we were only going for like 4 days. So I was like, I'll rough it if something happens. I've definitely had like some lows. I've had some crazy highs just because of adrenaline rushes. I feel like depending on what I'm going through that day, they could either drive me really, really high or drive me really, really low. There's times I was definitely a little too high at half times, and I was like, well, what am I going to do? Because if I do dose myself, it's just going to double down and bring me down way too fast. And I did have a player, and I currently have a player who has had, was experiencing lows before games and stuff. And I kind of had to educate her on why lows are a big deal because a clinician hadn't really been able to walk through that with her. And I was like, lows are scarier than a high. A high we can work with. A low, that's like a stop everything. We're not, going to keep moving and pushing, because she was 47 and trying to go into a game. And I was like, this is a good moment to kind of educate. And kind of when I sat down with her and talked to her about it, like she understood the importance. But like you were saying, Austin, I sometimes had to learn that like trial by I didn't understand. I knew lows weren't good. I didn't realize how truly fatal they could be. So that's been a huge experience. And like sports definitely forced me to understand that very, very quickly. If I not even wanted to be successful, just wanted to be able to be active or playing or doing anything.
I'm sorry, do you wear a pump when you play? I can't remember if you said you pumped or not.
No, I've never pumped. Nope.
Okay. Yeah, because I
I
mean, I definitely relate with the CGM getting ripped off during
yeah.
lacrosse. And for the longest time, I would just put my pump in my jock strap, and so that's what I did all through college when I played. And I broke many of them doing that. So
Yeah, no, I've never pumped. I'm getting close. I don't know how you guys have ever felt. I'm super big on, independence and I don't want anything dangling from my body. So the CGM took like a lot of convincing. And then like you said, Austin, as soon as I got it, I was like, what the hell was I waiting for? Like my life is so much easier
yeah,
now. And now I'm just waiting for my right moment. I think it's coming soon with the pump, but I never wanted to rush it and like rush into something and then immediately not like it just because I wasn't ready. So,
Yeah, I'm a big fan of the Omnipod. I wasn't. I think like I always have a little bit of resistance because like I think about the OG pump I was on, which was like a huge battery pack that looked like an iPod. And now like this has no wires and is attached to my stomach and I can wear a skirt and it's not gonna like be clipped to it or anything like that. But immediately I understand that resistance to it, but could be absolute game changer. Like I haven't had to like having an automatic pump. The first like 2 months I was like, I hate this. This is so stupid. I don't like it at all. And now I'm like, oh wait, this is probably the easiest my diabetes management has been in my whole life. And that's like well controlled, but at least try it. The Omnipod doesn't count as a pump.
yeah.
If anybody needs to know that, it doesn't count as a pump. So if you don't like it, you can just stop and it doesn't affect your insurance.
Yeah, I'm fully waiting to kind of kick myself for how long that I've pushed to try it. So, but this fall feels right.
I'll
So,
hold you to it. Has anybody ever felt like diabetes burnout, especially as athletes? Like
oh,
when you
I love
get
this
like
topic.
angry?
I was going to ask you guys.
I know I have. I've for sure. Within my speaking of like low sugars, I had a pass out from the Guardian system, so I immediately like switched from that to the Dexcom from there. But like I was so fed up with any kind of diabetes, and I was like, I have to take care of myself. I mean, I'm not gonna not, but oh, it can get tiring if you're doing it every single day. It's always there. You literally like wake up and you're like, okay, I don't want to die today. What has your guys' experience been with diet burnout?
I usually budget myself 1 to 2, like one mental breakdown, maybe every 2 to 3 years. And like I can't explain it. It's like the last one I had was literally like 2 years ago, and it was just high, low, high, low. Like, what the F am I doing wrong? I am so sick of this. And I just like tears, crying, just let it all out. And it's like, all right, I'm good. But I like seriously, it is never not on my mind. So that definitely catches up. And I think having a strategy to work around that and having like a really good support system in your family, friends, loved ones, healthcare team preferably, I think is like a big contributor to that.
Definitely. For one thing, like my parents started celebrating my diaversary as like a birthday to make me feel more positive about it. I definitely budget myself like at least one day a year to sit there and be like, this actually sucks. I don't want to do this at all. I'm definitely someone who will always say, like, has this made me a very motivated, like focused person for sure? If I could not have it, I would choose to not have it. Like if I could wake up and eat a stack of pancakes and go on a run and not carry, gummies, a glucometer, a glucagon, like all these things with me, I would always choose that. Do I also think it's made me the person that I am? Absolutely. And I was actually having a burnout a few years ago, kind of near COVID. And craziest thing happened to me again. So one of my best friends in the world actually got diagnosed with diabetes on my birthday. And same thing as me, she had no family history or anything. And it was kind of around a time that I was feeling down about it. And she looked at me and said, I'm not scared at all because I've watched you do this. And I know it's not going to be easy, but it's totally something that I can handle. And maybe like you have it so that you could help me through it. Like, I don't know. And kind of just like reframing my mind again. Like, that's what it takes to get out of a diet burnout. Like, it's always going to happen, you know, because we're always, I mean, maybe not always if they find some sort of cure for it, but like just understanding that every day is different. It's not always going to be perfect. And I definitely press that onto my athletes of like, you can have a crappy day. You can have a really crappy day. Like, you don't have to walk around being super grateful for this all the time. You know, be grateful for the technology that helped us get here. But like, if you're not having a good day, you don't need to explain that to anybody. It happens. It's going to happen more than once. And you kind of just have to get comfortable in that uncomfortable space. And, you know, you'll always push through it because your health matters and you care about your life and your health and your safety and your family and everything. So
I think I haven't had any like burnout that I can point. Or I've had burnout, but not that I can like isolate to a single cause. But definitely, this is a big part of the mix. And you know, on reflection, it's like we are never off the hook. And so, and that's not something anybody. You know, most people are off the hook on any given Saturday night or any given evening or whatever. And so, I'm sure there's a pretty high chronic stress burden. I think, and then maybe not. This is not burnout, but more like. I think what did weigh me down was the kind of longevity implications and the cardiovascular risk. And so like when I was like 18, 19, I started kind of freaking out about like chest pain that I thought was like related to the heart. Went to the ER a couple times, like in quick succession, like just really nervous about that. Well, I guess one antidote was to actually just, you know, do the blood work, like the sensitivity CRP, actually got a I think it was a CT scan or a coronary calcium test, and just to be assured, like, okay, I'm young right now, so I should just like put this out of mind for now because there's no risk right now. I mean, okay, a general antidote, like, you know, if you look at the cohort studies, like from people diagnosed in the 60s, 70s, 80s, they do have a longevity deficit caused by the diabetes and on the order of a decade. Now, we can treat that as enough bound, I think, for us, because obviously our management has been better throughout our lives. You know, the tools have been better. And so I think, you know, we shouldn't expect to have worse outcomes than that. But that's still not great. It's still a little like, come on, like we have to be like more stressed and live shorter than like our peers. That kind of sucks. But one kind of psychological tool that has helped me is just to put that in the context of like other humans more broadly than just people around us that don't happen to have diabetes. Like there's been 100 billion humans that are dead. They died at 40 on average. They did not have the healthcare we have, right? And so the fact that our life expectancy might be 75 instead of 85, it sucks, but it's also, you know, in context, it's less severe, and also maybe it makes us more conscious in ways we wouldn't be, and so we end up, you know, taking care of ourselves more, and maybe we get more out of our days because we're the sort of people that, you know, can be diligent about stuff, you know, like day in, day out and persistent in that. The other thing, I think, this is going back to something you mentioned a while ago, Allie, about kind of being like the perfectionist kind of mindset that we're sort of taught that we have to have around blood sugar management. I think being stressed about our sugars does more harm than the sugars themselves. Like, you know, that creates a bigger burden. You know, I think our bodies are actually somewhat good at buffering against the consequences of the sugar oscillations. Like, you know, if you paid attention to what the discussion around like wellness over the last few years, you were hearing people talk about how important it was to keep sugar in range, how that's the key predictor of longevity and all this stuff. It's like, if that were true, then there wouldn't be diabetics running around with a 13 A1C for decades in a row. Like, obviously that's not good for you, but it's not like you die overnight from having your sugars reach 200. Like, you know, I feel like that, yeah, like I'm almost ashamed to say that I've been 500 plus or I've been 28 as my lowest sugar ever. But it's like probably having a positive attitude and finding meaning in life can offset the negative health implications of having diabetes.
On that note, on the positive attitude and coming back to this concept of healthcare, which has come up a number of times in this conversation so far, I feel like from the outsider perspective, the attitude that your healthcare provider brings to you is probably going to reflect how you take this initially and how you continue to take it at your upcoming visits that way. And I've seen this on the rehab side in the sense that sometimes people go in and work with someone and they're all excited and fired up, and they actually look forward to seeing a healthcare provider, which sounds crazy to some people, but it's nice to know that healthcare can actually deliver a positive experience on occasion. And on the flip side, I've certainly seen the other side of the coin where, you have that rushed provider, like you all outlined earlier, who's on patient number 100, whatever for the day. They just want to get in and out and get paid. And there's this sense of not caring there. And that's not to say that the provider doesn't care, but that's just the impression that the patient gets by just kind of being brushed off that way. And I think that it's certainly great to develop a clinic space or a healthcare space that is inclusive in that sense and also understands the unique demands of someone with type 1 diabetes. I distinctly remember out of school, when we were building the clinics that way, one of my first purchases was this giant freaking box of fruit snacks, which is still sitting in the corner of the clinic, because we occasionally have someone who needs to down 1 or 2 or 3 of them in relation to exercise that way. But I really want to know from you all, if you're going to kind of break it up into like a checklist item of green flags or red flags from a healthcare provider standpoint, or some kind of like almost like makeshift guide for someone with type 1 diabetes, questions to ask, things to consider when working with a provider that way, what kind of things come to mind in that space? And then how can we as providers do better for all of you?
One of the notes is treating me as a person. So holistic care is really important as a type 1 diabetic. I kind of have like 2 ways of thinking about this. What I would go into asking as a type 1 diabetic, and then what I'd expect from my endocrinologist or PA or specialized person. As a diabetic, I urge you to be surrounded or have a community of diabetics to fall back on and ask if that's a normal thing to happen. Because I had to change endocrinologists because I was outgrowing them. Having somebody to fall back on and ask those questions is really nice. So as a diabetic, making sure of that. If you can choose somebody who's specialized in type 1 diabetes specifically is really nice, because endocrinology is a really wide sphere. And if they're treating type 2 diabetics who are 80 and you are a 20-year-old type 1 diabetic, that's going to be a little bit of a different experience. They're going to recommend things that you might not need, or it might not be as specialized. When you're looking for a provider, see also how long that they're willing to spend with their patients, because if you have somebody who's willing to spend an hour with each of their patients and they aren't as rushed, you're going to get more specialized care, and you're also going to have constant contact with them, which I've found really useful. I don't need as many appointments, but I do want to be able to send them a quick text or a quick call to be able to like verify what I need changed. And then as a diabetic, getting independence within treating your diabetes and learning how to trust how you're feeling and adjusting that. But from a healthcare perspective, I would ask that endocrinologists really focus on treating the people holistically, listening to what they're saying. Diabetes can make you feel like you're crazy, especially when you're like double checking things constantly looking at numbers. If you're coming in, and whether that be in burnout or frustration, just having somebody that will listen and try to game plan with you, not force an opinion or force a fast solution, has been life-changing for me. But what have you guys found as good, bad, what you need, what you don't?
What you said about the fast solution resonates. Like, I've been lucky to have some endocrinologists that can take some time and walk through things. But one of the things that sort of frustrates me is like they'll take like the last 2 weeks' numbers and like try and tell you how to like fix them. I'm just like, you have no idea. How do you have any idea? Like, you can't tell what I ate this day, like based on my blood sugar charts or whatever, or any, so that's one thing. Like, I feel like I'd rather be kind of asking questions that are appropriate for whatever my concerns are, rather than like have a kind of like template, like, let me just look at your charts and tell you how to manage your stuff. Like, that's one thing. And then I guess red flag, like for the entire medical system, is like, there's not really a focus on being healthy. There's just a focus on treating disease. And so I feel like we almost have to form our own frameworks and learn how to be healthy. I don't know. One of the things that's interesting is for diabetics in particular, there's some nutrients that seem protective. So like in Europe, they prescribe alpha-lipoic acid, which is an antioxidant that basically protects nerves from damage. So that's prescribed, I think, broadly for type 1s, but you can use it specifically if you've got neuropathy related to diabetes. And then also I've learned recently about taurine. And taurine basically, at least in certain studies with mice and then also with human subjects, it protected the endothelium against the damage created by high sugar. And like that, I think if I had to say one place where diabetes is going to cause our bodies to wear and tear more quickly, it would be the endothelium, because like that's what is having exposure to that like high level of glucose in the bloodstream. And so you get breakdown, and that's leads to microvascular disease basically. And the fact that taurine can like mitigate some of those effects, or maybe mitigate them all, I feel like, the healthcare I want is basically telling me what I can eat, what kind of components I can include in the diet that are going to be protective in that way. But I mean, even in addition to just those few nutrients, like it's just broadly like good nutrition to keep the body like nourished with the stuff it needs and metabolically functioning well and insulin sensitive and all that. So I feel like you'll learn more about that from examine.com than you will from your endocrinologist.
I'll piggyback a little bit off of Kara. Like I at least understood as a patient eventually, like my mental health has a direct impact on the way I am able to handle my diabetes and take care of myself every day. And the reverse is also true. If I'm struggling with my diabetes, eventually I start to struggle with my mental health too. So as a patient, like kind of had to understand that correlation and how to be comfortable talking about that to my endocrinologist or to my primary care, because everything matters when you're diabetic. It's not just, the blood sugar, it's everything else too. It is a holistic approach. And I definitely had to learn how to advocate for myself, because like you guys were kind of saying, not every clinician understands all the way. And I don't know about you guys, sometimes I've actually found the worst clinicians for me to be the ones that were type 1 diabetics themselves, because it was kind of like, well, this is what works for me. So being able to advocate for myself and understanding that like there is a perfect doctor for you somewhere. And I finally like settled for one in the first 10 minutes I'm in there. Maybe he just asked about how is my job going? How, what am I working on athletically? Like, am I still playing in the soccer league in the fall? Am I still coaching? Am I still training for a half marathon? Like just that mental well check and being able to understand that some people don't know everything and be willing to get over myself sometimes and educate them in a space that they're willing to be educated on. But for clinicians, I'll always just bring it back to like what Kara said of I'm a real person who is really trying. Zach, like you were saying, looking back at my last 10 days of my CGM is really not going to paint you a story of what my life looks like, because I might have had a really awful 10 days just in life in general, because diabetes is so much more than just like what I'm eating or what, I bolus for and what I might have needed to bolus more for. It took a lot to find the right team that worked for me, but it's always worth it in the end, because I used to fear endo appointments. I was never looking forward to them on the calendar because I was always worried that someone was going to tell me I wasn't doing well or not really pay attention to my entire body and my brain and all the things that were playing a part in it. So advocating for myself, helping others advocate for me, and like as a clinician, I'd always just encourage them to just be really open-minded, because it's a lot. And my thing is I always say everybody always has their something, but it's always important to pay attention to what someone's something is because it matters to them. So really diving into that empathy as a clinician is more important and means more than I think some realize.
Yeah, I think you nailed it there. I mean, you basically said everything I was going to say. The endo I see now, back to Kara's point, I see him for upwards of an hour plus. And as a clinician myself, like that's a lot of time to dedicate to one person to kind of talk about things. And granted, I'm only seeing him like once a year or once every 6 months. And also your note too, just like, he knows I'm still trying to play lacrosse. We've talked about like diet and all that. I think all of that is integrated. Even personal life too, stresses, work, career growth relationships, like all that has an impact onto the daily motions and things that we carry with each of us. And then that is one-to-one in terms of like that hormonal response, which will obviously affect the blood sugar. So yeah, I think that's the key there, just being empathetic and showing that you care.
Completely agree. And, the other thing I really want to bring up, you all mentioned the importance of treating people as people at the end of the day. And I think that's so, so essential to understand that we're not treating a diagnosis or working with a diagnosis. We're working with a person at the end of the day. And you never know what that person is going to be able to go out and accomplish in the future, whether it's acquiring an MPH or earning an MPH or starting a company that gets a $200,000 investment on Shark Tank from being a type 1 diabetic for a low carb snack that actually tastes freaking good. And beyond that way, I think that there's so many intangible effects that can come from just empowering people at the end of the day and letting them do what they do. And you never know what impact someone can have on the world. So I think the more that we treat people as people, the more likely they are to use what has happened to them and say, I'm not that, I'm what I've chosen to become. And I think that the more we kind of dive into that, the better the entire space is going to be, not just healthcare or athletics, but the whole freaking world. Because I don't know about you, but I think the world needs a little bit more of this stuff lately.
I would agree.
Well said.
Completely agreed.
As we start to wrap up here, is there any closing thoughts or closing remarks or anything we missed as we were chatting today?
There was something that I kind of forgot about mentioning, but we were talking about like being surrounded by diabetics. And there was a camp that I don't think a lot of diabetics know about. It's called Camp Sedabaid, and it's a type 1 diabetic summer camp, essentially. And if you know any young type 1 diabetics or anybody who could benefit from it, they have a lot of great information. And it was a really foundational thing for me to learn about diabetes. I think like anybody in PA basis, there's also a whole bunch through American Diabetic Association. I wish it would have been communicated more to me, but I had good endocrinologists who recommended it. That could have been life-changing for a lot of people I know getting into sports at a young age or anything like that with diabetes. Especially as a clinician, PT, anything like that, it's a good recommendation for anybody you have who has diabetes and it's in sports. But besides that, knowing you're not alone in diabetes is really important. You have a community of people. I go up to every diabetic I see with a pump or a Dexcom, knowing that there's somebody out there like you. There's millions of us. You're not alone. You have somebody to reach out to. If not, there's 3 of us here, 4 of us. You can reach out, ask. I know I'll be more than happy to talk to you about it, but that's kind of my last point.
Yeah, I'll second that. It used to be something that I hid about myself. There was a long span of time where people actually, went in college or in high school had no idea because I just didn't talk about it. And I did, my shots under the table or checking my blood sugar under the table and no one had any idea. So I had to learn how to embrace it myself because I had no idea the impact it might have on other people. And especially now as a coach, like embracing it because I've coached athletes that have it and I can see it in their eyes how helpful it is just to be comfortable with what I go through and comfortable like with a struggle sometimes or like being really, really proud of like the really good days that I have. And I will also, just because I was a college athlete and a high school athlete, I'll give lots of love to athletic trainers because they're clinicians too. And I still work with my high school athletic trainer because I coach at the high school I went to. Shout out to Kelly Rose, that's my girl. After I was diagnosed, like she made a world of difference, and the trainers that I had in college made a world of difference. Like that's where I really had to learn that, there's so many things, especially like, PTs or athletic trainers have to know, diabetic athletes, they're not coming across every single day. So I had to learn how to be comfortable helping them understand, like, what do they need to know about me? What do I expect from them? Do I want them to have my Dexcom password, my phone during games, during practices? Do I want them to hold snacks? So like I was very lucky in the sports space to have athletic trainers that really genuinely cared like how I was doing every day. And they went out of their way to make sure that I was always comfortable with the effort that they brought to me. And that made a huge, huge difference. So I'll always give lots of love back to the athletic training world because they have to worry about so many things, and it always meant a lot for what mine did for me.
Coming off of that, I just have two brief thoughts. The first one's going to sound a little tacky and played out, but don't let it define you. That's something I pride myself a lot in is the things I've been able to accomplish in my life and the doors it's been able to open up for me and kind of like truly making lemonade out of some pretty big lemons. But I've also met some individuals where they kind of get really bogged down by it. And I think in a way, briefly, that they kind of let that diagnosis define them. And I just encourage people to not let that be the case. And you can be so much more than the person with diabetes. And I think on the other side of that too, you got to embrace it and you got to champion it. And it's something I've been challenging myself, especially over the last 2 to 3 years, as I've kind of spent a little bit more time on social media and having access to a platform. I know I don't talk enough about it. Part of that's just because I get in my own head of wondering like, who the hell cares? But I think the other piece of that too is that it is like visually, it's a disability, but you can't see it unless you're kind of trained and you're looking for the wires of an insulin pump or the bump of an Omnipod or a CGM. So I think that's just another point. Maybe we could talk about that a little bit too, just like, especially in an athletic sense. I've had a lot of people come up to me and people I've known for a long time to be like, oh, dude, I had no idea you had diabetes. So I definitely take a little bit of pride in that because, again, I don't want it to define me, but I think there's something there too as well to know that like just because you can't see it doesn't mean that they're not dealing with it. And I think for those of you who either have patients or have athletes or just have loved ones who are close, like the best thing you can do is just ask them and check in on them and say, hey, like, how are you doing? That could be from like the mental side. We talked about that earlier, like the burnout side of diabetes. It could also just mean that day in that moment, what's your blood sugar at? Like, how are you feeling? And how can I be a support for you?
Okay, maybe two things also. I noticed that there's often a disclaimer, don't do this if you're diabetic. So intermittent fasting, don't do it if you're diabetic. I noticed like doctors would kind of, as you guys all said, kind of discourage like elite physical activity or even attempt at that. And well, I think the reasons they would encourage us to kind of live within the constrained framework of 3 meals a day, three boluses, long-term insulin, and like don't do these extreme things is like it's clear enough. Like there's a safety and like a precautionary principle that's like first and foremost in their minds. But like on the other hand, in a review, it was shown that the people that use the lowest sort of the bottom 25 percentile of insulin users actually have the best long-term outcomes. So we do want to stay insulin sensitive and metabolically healthy and keep our insulin relatively in check, and don't want to like let our insulin levels balloon, kind of like many Americans kind of do when even if they're not diabetic. Like that's what's going on internally is that their insulin sensitivity is decreasing, their carb intake is too high, activity is too low, insulin levels are very high, type 2 diabetes onsets, etc. So I think there's something a little perverse also about like not being able to explore those like activities that might actually be metabolically enhancing, like fasting. And I think I found that as long as I'm cautious not to go low, and I know what precautions to take around that, and as long as I'm cautious not to go into ketoacidosis, meaning always have some insulin on board, then it can be a great practice and it's worth exploring. So I mean, as long as you're staying safe, I think you don't necessarily need to inherit some of those precautions that your doctors might insist on. That's one thing. Second thing is another review showed that you want your A1C to be low, but not too low. And there's a kind of a danger zone. Like if your A1C is too low, and your range is too tight, and you're kind of skewing low, you'll desensitize yourself to having hypoglycemia, and then you might end up basically fatally low or something like that. And so, and you kind of, you don't want to be so obsessed with keeping your blood sugar low that you put yourself in that risk zone. That's kind of for me, that's almost like, it's almost a good thing to hear that, like, it's actually, there's such a thing as being too hyper managed and having your blood sugar too controlled. Obviously if you were always at 100, that'd be perfect, but you can't be. And so if you're in the 60 to 100 range all the time, that's kind of more dangerous than being in the 80 to 120 or 100 to 140. So, I thought that was actually kind of reassuring. Like, we shouldn't aspire to be absolutely perfect in this. We can, we can live normal lives, and that helped me to feel a little better
That's awesome. That's awesome. And for people who want to find out more about you all and check you out online that way, where can they find you at?
I'll go first. You can find me on Instagram at Lax Rehab. So, like I said, I work with a lot of lacrosse athletes coming back from injury within the physical therapy realm. So, if you have any questions or interest in that, you can find me there. Or if you guys ever want to talk shop about diabetes or just have someone to talk to regarding any of that management, ups, downs, feel free to reach out on there. My email's on there, and I'm pretty responsive to the DMs.
Yeah, I'm on Instagram too, Allie O with 3 L's and 3 E's and 1 I. I'm definitely always happy to talk to anyone about it. Bad day, really good day, average day. I find a lot of peace in talking to people who get it too. So feel free to hit me up about anything, anytime. I've had the best time talking to you guys, and I would enjoy talking to anybody who wanted to talk to me about it.
Main hub for me is Kara M. O'Rourke on Instagram. From there, you can find my website, DMs, email me, whatever works for you. I'll respond to, especially if it's somebody reaching out about diabetes. Practice, not perfection, is the thing that I live by with that. So if you want to talk to me about how it's been going, good, bad, ugly, whatever. I also kind of share a little bit of knowledge with my experience in diabetes and weightlifting. So if you want to know how I did it, there's that. But we can talk about how you're doing it too. So that's where I'm at.
Nice. I'm Zack, Z-A-C-K, at lifestacks.com. And that is a supplement company. We try and do stuff that is metabolically supportive and also basically supports mental state acutely. So kind of that balance. And we actually do use taurine in one of our products, and I'm proud to say we use a whole gram of that. So yeah, check us out and feel free to email me with anything.
That's awesome. I really appreciate all that. And we'll link to all of those in the description below. That way, if you didn't quite catch it, you can just click there and see how to get a hold of everyone online. Zack, Allie, Kara, Austin, I really appreciate your time. This was amazing. And thank you so much for being so open and honest with your insights and everything that you shared with us today. Thank you so much.
Thanks for having us.
For having us.